moment. Also, Jamie Cook, our Secretary of the Arkansas Department of Public Safety. We have Scott Hamilton here, who is the CEO and President of the Urban League of the state of Arkansas. Thank you, Scott, for being here. We have Rosa Velasquez of Arkansas United. Rosa, behind me. And then Jimmy Warren, who's a citizen advocate from Conway. Thank you, Jimmy. And then Tim Campbell, who is also with me, who has been one of the leaders of the protest movement. Probably others could be included in that category, but Tim, thank you for being here from Little Rock. I think we have Scott Bradley that will be, Sir Scott Bradley with the Arkansas Sheriff's Association. Thank you for being a part of this as well. And did I include everybody there? I think I got everybody. A recurring theme over the last few weeks, ever since the tragic and death of George Floyd, has been the need for improved law enforcement training, the need for increased racial understanding and accountability in law enforcement. And as everyone knows, I have a long history all through my public career with law enforcement. I identify with law enforcement. But the most critical element of law enforcement is trust. Trust with the community, trust with individuals, trust that you're acting with integrity within the law. And obviously with the death of George Floyd and being seen across the nation, that trust has been undermined. And I think we've all learned that we can do things better, we can relate to the community better, we can exercise racial tolerance and understanding much better. And so that recurring theme has been reinforced by my discussions with a number of the protest leaders here in Arkansas. And I visited with them. They come across and they are very genuine, they're very sincere, and they're very committed to change and see things improved in terms of the relationship between law enforcement and the community, and also to make sure that we have the right accountability for our officers, and particularly those that do wrong, and particularly those that exercise prejudice in their law enforcement activities. So today, as a result of these discussions and as a result of what we've seen across the nation in Arkansas, I'm signing an executive order today which creates the task force to advance the state of law enforcement in Arkansas. And I want to cover a little bit of the purposes of this task force. The members of the task force shall have the following duties: to review the adequacy of law enforcement training, policy, and operations specifically related to cultural, racial, and community relations. To study and analyze the processes for accountability, discipline, removal, and decertification of officers who do not meet the standards, including an evaluation for the creation and implementation of a statewide public database of complaints and resolutions concerning law enforcement officers. These are a couple of the matters that I think Jimmy and Michael have identified as things that are needed to be reviewed and studied. It's also to review community policing and how that can be enhanced in Arkansas and more effective. To study the standards, requirements, and obstacles in recruitment, hiring, and retention of law enforcement officers, recognizing the important work that they do. Make recommendations to the governor on enhancing the trust between law enforcement and the communities, and make recommendations to the governor on improvements or changes needed to enhance the profession of law enforcement to ensure compliance with standards. This task force will make a final report to me by December 31, 2020. And the work of the task force will be concluded upon submission of the report. Some of the attendees or members of the task force that are not here today, I'll just read a couple of them. Percy Wilburn, former chief of police in Lake Village. He's Vice Chairman of the Arkansas Commission on Law Enforcement Standards. Shirley Washington, the Mayor of Pine Bluff, who I'll see a little bit later, will be on this task force. James Sanders, Mayor of Blytheville. Tim Helder, Sheriff of Washington County. Kendall Collins, Assistant Federal Public Defender, will be on this task force. And the other will have representatives from different branches of law enforcement there. And there will also be additional citizens that I can name to this task force as we go forward. And I want to thank each of the attendees that are here for their agreement to participate in this important task force and the work that is ahead. I did want to also make one other comment about law enforcement. I do want to emphasize the support that I have for law enforcement, their dedication, their sacrifice, and the critical role that they have in public safety. I also want to be clear that there will not be an agenda item on defunding law enforcement through this task force. Now, it is always a fair discussion as to how funding is used and where the needs are, and that discussion is fair and can be a part of this. But I've talked to the members of the task force, and this is not to take away from law enforcement. This is to enhance law enforcement, to make them more better trained, to make sure that they have adequate discipline, that they have adequate accountability, as well as the other items that I've mentioned. I've asked Fred Weatherspoon to chair this committee, who has an incredible history. And before we turn it over for questions, I want to invite him to come up and to make a comment on this important task force. And I might add, in talking with Secretary Cook, that our law enforcement standards in Arkansas were brought about over 45 years ago. And since that time, there has not been a comprehensive review of our standards, of our accountability, and how we can improve the current system of training and holding our officers accountable. And that's an important part of it. So with that, Fred.
Thank you. Hello, everyone. This is an amazing opportunity for us in law enforcement to regain the trust of citizens throughout our communities. And this can be done through collaboration. And I think the collaboration starts today with this forming of this committee that has a very important task ahead of it. Remember this, change occurs, no change occurs without open and honest communication, without embedded agendas or ideals designed to undermine as concepts are being discussed. So with that, that's going to be the basis and the premise for which we will do our work. We're going to try to reassure the public that law enforcement are here to serve them and to keep them safe. I also like to share a little history in reference to why I feel important to be a part of this here task force. And I must go back to when I was a 10-year-old child and relate an incident that occurred that had forever changed me in my attitude toward law enforcement and guided me on this path to where I am today. As a 10-year-old child, I also experienced the after effects of police brutality through my father's incident. My father was arrested some years ago in Jefferson County, and he was arrested, and then he was, during the process of this arrest, he was subject to excessive force by the officers at the time. To the point that when my mother and my uncle brought him home, that myself and my older brother, we ran from him because we didn't recognize him because of the severity of the beating he had received. So throughout my remaining years, I too had a different perspective about law enforcement and their true purpose. But as I matriculated through and attended college at Southern Arkansas University, and after graduation, I had an opportunity to go to work at the Magnolia Police Department, where I worked for nearly 10 years. But prior to then, a good friend of mine who was also working at the police department prior to my decision to go to work there. He asked me why would I be interested in becoming an officer for the city of Magnolia. At the time, I declined, and I explained the reason that I just shared with you. But after a few days of deliberating on this conversation, and he had said, Fred, that would be your opportunity to make a difference, to make a meaningful difference in law enforcement and how people view law enforcement in the future. And with that encouragement from him, I went, sat, and talked with the mayor at the time. And I accepted his offer to become a police officer with the city of Magnolia, Arkansas. And through that opportunity to become involved with the city and the community leaders, I feel like that we did make a difference in how police were received and accepted in the city of Magnolia, Arkansas. And after leaving the city of Magnolia to come to work as a training instructor at the Arkansas Law Enforcement Training Academy, that was another opportunity that allowed me and all the training instructors and administration at the time to also engage on an opportunity to improve that relationship through our training efforts. And through that training efforts, we have extensively, particularly under the leadership of Ms. Jamie Cook, we have consistently reviewed our training curriculum, and through my day-to-day oversight, I ensure that our training curriculum is carried out to the letter, that our training is done with integrity, and that the things that we stand on are constantly reinforced. So when students leave our training facilities, I am very confident that they are well grounded in the right way of doing things. And that is going to be the purpose of this committee, is again to reinforce those things that they were trained on, and to reassure that they do not and will not divulge from those things in the future. Thank you.
Thank you, Fred. And just as a little background, the state's role in this is to certify through our Commission on Standards law enforcement officers, police officers all across this state. And Secretary Cook was telling me that I believe it was in 1996, there were 6 officers that were decertified because of violating the conduct that they should carry out as law enforcement officers. 6 of them in 1996. Last year, 40 were decertified. Now, this is not going to be a static task force. It's going to be dynamic. It's going to be listening to the community. It's going to be addressing the serious issues that we've seen reflected across the country. It's also going to reflect as to the needs of law enforcement as to how we can enhance their training, their accountability, as I've said. With that, I'll be happy to take any questions. Yes, ma'am. We're right here.
What kind of things were you taking into consideration when making the recommendations and picks for the people part of this task force?
That we wanted to have people who are involved in the protest, leading that discussion, which are mostly young people. We wanted them a part of this. So we wanted this task force to reflect the community. We also wanted to have a reflection of law enforcement so that they can communicate one to another. And that's a pretty good dynamic for change and for improvements and for finding the gaps. Just because we've been doing this since 1978 does not mean we're doing it right or we can't do it better. And so that's who's made up in this task force. I think it's a good balance. As we see gaps in the task force, I'll be able to add to it.
What do the current standards allow for in regards to chokeholds, and is that something that this task force is going to be looking at, and do you support eliminating that as the tactic?
Fred, do you know the answer to that?
There is no
Why don't you come up with the microphone? Come with the microphone.
Currently during our training at any of our training facilities, we do not implement training chokeholds.
Okay.
But are they specifically barred? Or is there training against the use of that?
We advise that the use of excessive force to include choking someone is not part of our training curriculum.
Thank you, Fred. And so there's not a law that prohibits it in Arkansas. It's not trained as an effective tool that's utilized in our law enforcement training academy. As to whether that should be further addressed in terms of any prohibitions or other constraints on that individual departments might use, I think that it can be a topic of this task force.
Little Rock is doing an independent review of their entire workings. Would that be something that you would support from a statewide standpoint?
I did see what the mayor did in terms of the city of Little Rock, and I applaud him for that initiative. Obviously, this is looking at it from a statewide perspective, and we'll probably learn from each other through that process. So I'll have to look at more of the details as to what they have done and what their plans are. But this task force is designed to look at all police departments, at all certified law enforcement officers across the state.
Has there been any more pressure or thought into removing the Confederate statue here on Capitol grounds?
That is a matter for the legislature to address if they wish to do so, and I haven't heard any discussion that they're going to bring that up. Yes?
Do you consider forming this task force as overdue?
You know, whenever you look at the fact that we've never done this before, I would say yes. I think this is, would have been nice probably to do this 5 years ago, but we didn't. And so this is something that we have seen in recent days as certainly needed, both in terms of a substantive review, but also in terms of a relationship with the community and to improve that communication.
How did the selection process work when forming this task force?
How did the selection process occur?
Yes.
Well, it's my task force, so I get to make the selections on it. But I have met with a number of the protest leaders that we had a good dialogue and communication, but more broadly, as a result of the protests, I've had communication with a number of leaders in the community. Many of those are reflected in the task force behind us. Others are on the task force membership. And they were selected because they're representative of the community and of the protest and what is needed. Jimmy Warren here, whenever we met with him, he handed me a list of what he would like to see. Is that right?
Yes, sir.
He was very clear that he would like to see these things done, these steps taken. And Tim right here, when I met with him on the first time, he said, this is what needs to be done. And he said, in fact, I demand this to be done. Is that what you said?
Yes, sir.
That's what he said. And so, I've seen him on TV, so I know he's a protest leader. But they were selected because not that we're in agreement on everything, but that they bring a reflection of the community to this discussion that I believe is important in combination with our law enforcement community.
How many times is this task force expected to meet before December?
Well, I would expect that they will meet within the next week. Need for meeting. This will be staffed by staff will be available to them to help them in the process. But I'll leave it to the chairman as to how much they meet. But I'm sure that they'll be meeting very regularly between now and the time the report is needed. Yes, right here.
When was the time as far as when you started thinking about putting this together?
I started thinking about putting this together after I met the first time with some of the protest leaders, and I recognized that what they're asking for ought to be done, and that it's something that we can have common ground in pursuing. And just so that you'll understand that this whole area has not been neglected in my administration, I have already been working on sentencing reform and some other things that are also important to the community in fairness in our sentencing, in our use of incarceration, and that's something that is separately being examined. But this is a very important addition to it to look at policing as a whole, certification, accountability, and training. One more. Was there? Yes.
Do you intend to use this task force to continue the conversation even after the report for this year?
Well, let's wait and see what the report looks like and what the recommendations are. If they recommend continued oversight or continued study in a particular area, that's wide open. That to me is something that they should be looking at.
As far as the recommendations go, do you have any expectation for whether those will be things that can most be done via executive action, or will it also require legislative action?
I would expect that there will probably be a combination of those. Some of them will just be actions that the Commission on Law Enforcement Standards will be able to take. There'll be other issues that might be funding issues that, one of the discussions might be body cameras. Well, body cameras take money if that's a decision that had to be made, and policy. And so I expect that there will be a wide-ranging set of recommendations that will involve funding issues, involve policy, and it could involve legislation. We'll just have to wait and see.
Do you think that law enforcement should better reflect, I guess, the racial makeup of those communities? I mean, obviously, your candidate pool is what it is at times, but is that something that can be done?
Well, I think that's part of community policing, that the police officers are part of the community and they know them. It's easier to do work and in a way of trust. And so I think that'll be part of the conversation. Let's see where that leads. All right, with that, thank you and everyone here is open to make any statements they want to make, but in the interest of shortness, I'll let you talk to them afterwards if you desire. Thank you very much. Okay. Good afternoon to everyone. First of all, it is great to be in Jefferson County. It's good to be in Pine Bluff. We just had a wonderful community meeting. I want to thank Jefferson Regional Medical Center for their hospitality today. We had a conversation with educators, with the mayor, Mayor Washington. Where is Mayor Washington? Thank you very much for your hospitality today. And I also want to thank you publicly for serving on our Law Enforcement Future Task Force that's been created to address the accountability, but also the support and training that we have for our law enforcement officials across the state. But we had a good conversation on education, on the economy here. Our legislative delegation that's here, I want to thank them for their participation and support for our fight against COVID-19. It's made a difference with our businesses. It's made a difference with our support for hospitals and how we've trying to pull ourselves out of this. And then we're glad to be joined by Dr. Nate Smith, our Secretary of Health, and I want to thank Chancellor Alexander for a wonderful face mask from UAPB. And so this will be a good part of the collection. I got a feeling all of these will wind up in my archives, and we're very proud to have that connection. I did want to mention one thing of a personal nature from me, and that is the recognition of a life well led but has passed, and Dr. Raymond Hull of Rogers, Arkansas, who was my family physician years ago, has passed away because of COVID-19. And I just wanted to recognize his life, his contribution, and it's just another consequence and reminder to us of the deadly nature of this virus in many circumstances. And he fought a very hard-fought battle and has come, but his family is wonderful. We are grateful for our history with them and wanted to recognize his life and his contributions. And now let's go on to our case report, which is of statewide interest, of course. Yesterday we had 9,740 total COVID-19 cases, and over the last 24 hours we've had an additional 340 cases statewide. I asked Dr. Smith to check, and he verified that of those 340 new cases, only 2 of those are in Jefferson County. And so a breakdown of that statistic locally. With the 340 additional cases, that brings us over the 10,000 mark. So we have now had 10,080 cases. Of course, over 6,800 of those have been recovered, but the total cases is now over 10,000. In terms of hospitalizations, yesterday we were at 171 hospitalizations. That's up 2 to 173. In terms of deaths, we have an additional 6 Arkansans that have succumbed to COVID-19. That brings us to 161 deaths today. In terms of testing for COVID-19, we continue to expand our testing capability and strength in Arkansas. And so yesterday we did 4,849 tests. That puts us on target for reaching our goal of 120,000 tests over the month of June statewide. But that is a lot of tests that we're doing across the state for COVID-19. I did want to mention in the southeast region of Arkansas, there's always been a question, are we getting tested enough? Are we getting tested enough? Well, we broke it down by test by region, but also per capita. And so this is a per capita scaling of the test. And so in the southeast region, we have done 694 tests per 10,000 people. 694 tests. Statewide, the per capita amount is 565. And so you can see that there's a greater level of testing that we've done per capita in southeast Arkansas. And that's important to know that we're measuring the outbreak of COVID and any new information that's necessary to control the spread of COVID-19. Here in Jefferson County, we've had 666 tests per 10,000, again compared to the average in the statewide of 565. And then let's go on to the slides. I hope that can be seen all right. I think it can be seen on television as well. But you can see today's breakdown of 340 cases, which is down from the height of 450 a few days ago. But obviously it's too high, partly reflecting the number of testing, the amount of testing that we're doing. If you go to the next slide, you'll see the 7-day rolling average. And this is important because you see the second peak is higher than the first peak. And then secondly, you see in the second peak, there is at least a downward trend the last 2 days, I believe it is. Go to the next slide. And this is a key factor on hospitalizations as to the capacity of our hospitals. And here, again, you see the first peak on hospitalizations in April at about 110. And now we're up to 173 that's hospitalized. And so that's something we're continuing to watch. This breaks it down to the southeast region of Arkansas on the number of currently hospitalized. Now, don't let the graph mislead you because the previous graph got up to 173, but this graph for southeast region, the highest point is 34. And so that means we're right now at a 30 that's hospitalized. Actually, it's a little bit down from that from yesterday, but you can see that that is a very manageable amount that's hospitalized because of COVID-19. The next slide, and this is the tests that are positive. And here again, you'll see, I haven't talked about the percent positive in the last 24 hours because that's corrected, will be corrected information. But this is the accurate information showing our positivity rate in Arkansas. And the 10% line is drawn across there because that's the standard that is set by CDC, that you don't want to give above that, which we have been above that. But even though we are really focusing our testing on those vulnerable populations, the areas that we know we're probably going to get a lot of positive tests, even with that, our positivity rate Looks like it's about 7%, something in that nature on the last day. And so those are continuing to be good numbers for us. And then is there another one? Okay, this just shows you, again, the increased level of testing that we're doing in Arkansas. Our goal, again, is 120,000 tests in June. And part of that is in our nursing homes and our patients as well as our staff. And so we are now at 28,862. We're on target to meet that goal. But let me tell you, as Dr. Smith comes in a moment, that's a lot of work by our hospital staff, our clinics, and the Department of Health to do and process all of these tests that are so important to know where we're going in Arkansas. And finally, before Dr. Smith comes, I know there's been conversation about where we go in terms of phase 2. I had a conversation with the leaders here earlier today, and I'll just tell you that we'll be making an announcement tomorrow on the Wednesday session as to the question answered as to whether and when we can enter phase 2. So stay tuned for that information tomorrow. And with that, Dr. Smith.
Thank you, Governor. I'd like to just make a few more comments on the numbers that the Governor's already shared. Governor mentioned that we've had 340 cases since yesterday, new cases. Of those, 34 were in correctional facilities, so 306 were community cases. And of our total cases of 10,080, 3,044 are considered active cases. Of those 3,044, 141 are in nursing homes and 139 are in correctional facilities. So we have 2,764 active cases in the community. The Governor's already mentioned that we had a net gain of 2 in our hospitalized, so we have 173 hospitalized. We have 44 currently on a ventilator, which is down 2 from yesterday. We have had 6 additional deaths, so we're at 161. And we have had 6,875 recovered, which is 245 more than yesterday. In terms of nursing homes, we've had 5 additional cases, so we're up to 488 total nursing home cases, and we've had 17 additional staff at nursing homes, so we're up to 332 for staff who have tested positive for COVID-19. The Governor's mentioned our testing. We had 4,849 tests, and that puts us ahead of target for our goal of 120,000 for the month of June. The Governor's already mentioned our testing per capita here in Southeast Region and in Jefferson County. I want to give some other details specific to the Southeast Region and to Jefferson County in particular. In the Southeast Region, we have had a total of 2,580 cases. Of those, 771 have been in the community, and 1,809 have been in correctional facilities. So we've had more than twice as many of our cases in correctional facilities as in the community. And so of those cases, we have currently 148 active cases in the community in Southeast Region and 109 active cases in correctional facilities for a total of 257 active cases. We've talked about deaths. In Southeast Region, we've had a total of 44 deaths. And of those, 32 have been in among community cases, and 12 have been in correctional facilities. Moving to Jefferson County, we have had a total of 559 who have tested positive in Jefferson County. And just, I don't think anyone here needs a reminder, but our first case in the state was here in Jefferson County, actually here at Jefferson Regional Hospital. This county and this hospital have been the tip of the spear. They've been on the front lines in our battle against COVID-19 and have done a remarkable job in containing and limiting the spread of COVID-19, although there continue to be challenges. Of those 559 cases that we've had here in Jefferson County, 320 have been in the community, 239 have been in correctional facilities. We have had a disproportionate case fatality rate here. The number of cases who have died in Jefferson County has been much higher than in the state overall. We've had 84% of our cases have ended up succumbing to COVID-19. That's more than 5 times the state average of 1.6%. And that's largely because many of our cases, especially early on, were in nursing homes here in Jefferson County, where we know that the risk of serious complications and death is much higher. So for Jefferson County, we have had a total of 28 deaths. Of those, 1 was in a correctional facility and 27 were in the community. We currently have a total of 52 active cases. 41 of those are in the community, 11 are incarcerated. And the numbers that I have, and I'm always timid about giving hospitalization data when I'm standing in the hospital because they could easily correct me if I'm wrong, so please do. But my information is that we currently have 4 hospitalized, 1 in the ICU, 1 on a ventilator. But I know those numbers change quickly, so you will have more current information here. I'd like to wrap up my conversation by just thanking the people here in Jefferson Regional for their partnership from the very beginning, and for the people of Southeast Region and Jefferson County for the work that you have done. This area has been hard hit in terms of deaths, but you've also done an extraordinary job of limiting the spread of COVID-19. It could have been much worse than it has been, and we value your continued partnership. So thank you very much.
Thank you, Dr. Smith, and I second that. I want to thank the whole community of Jefferson County for being such good soldiers in this fight and having success as well. And so with that, be happy to turn it over to any questions.
Governor Jay with KRK, I just wanted to get your response to Representative Sullivan's letter that he put out there saying that basically the northeast part of the state is going to open come Friday with or without your support. Just kind of want to know what you think about that and if you had a chance to speak with him on that.
I haven't spoken with him, and I get letters from both sides. I get letters saying you're going too fast, slow down, don't open things up. I get letters that says you're going too slow, you got to open it up quicker. And so that's just one of the many letters that I receive. Dr. Smith and I try to make decisions based upon the public health guidance, based upon the data that we see, but also what is needed for the uniqueness of our state. We'll continue to do that, and we'll have further comments tomorrow during the session. Next question, is there another, right here?
Did you expect this second wave to be as large as it is?
No, but it just illustrates the fact that this is unpredictable. We haven't seen anything like this virus. And in fact, many thought that the second wave would actually be this fall. And across the country, we see a second wave coming. And I looked at it last night. Tennessee cases are up. You've got states all around us that the cases are up. Louisiana is an exception. They had that huge peak, and they're going down. New York is a huge peak going down. But many other states have had 2 peaks. It's as I've said before, you almost have a different pattern in the different regions and different states that we see. So in Arkansas, the quickness of the second peak was a surprise, and the fact that we don't know where it's going to go from here is something that is still a little bit unpredictable. Is there another question remotely?
Yeah, Governor, this is Andrew with AP. Going back to the question on the letter from Representative Sullivan, if businesses decide to go into phase 2 ahead of whenever you plan on it, or in defiance of the restrictions, what kind of consequences are there going to be for them, and is Health Department going to be watching out for that? And also, on whatever your announcement is tomorrow, is a regional approach, is that still off the table, or are you looking at that for whatever you announce tomorrow?
We'll make that announcement tomorrow as to how we're going to handle the question of phase 2, as to whether we enter it, when we enter it, and how we enter it. So we want to, obviously we've been studying this very hard. I indicated last Friday we're looking at it, studied it over the weekend. We continue to do that, looking at the data. We'll make a decision on that tomorrow. In terms of what we expect in terms of businesses and compliance with the public health guidelines, many of the businesses are licensed, whether it's a restaurant or whether it is a different type of facility. If they have a license, then if you don't follow the public health guidance, then that could jeopardize your license. But I understand that people want to some people want to accelerate. As I said, some people want to go slower, but we still have a rising number of cases here in many parts of Arkansas, and we want to make sure that we're taking the right steps to control it to the extent that we can, and that we want to be mindful of people. Whatever phase you're in, we still need you to socially distance, to wear your mask, to protect yourself. That's one of the constants through each of the phases. Yes?
Dr. Smith mentioned the nursing home population, but is there anything else that could be contributing to the high death rate here?
Dr. Smith.
We know the factors that increase the risk of death include older age, but especially underlying medical conditions. And we know that diabetes, high blood pressure, cardiovascular disease, chronic pulmonary disease, as well as weakened immune system, these all increase the risk of death. And so if the people who are being infected have those underlying medical conditions, then that increases the risk. But in the case of Jefferson County, really what drove it was we had a couple of nursing homes that were very hard hit very early on in the epidemic.
Yes.
You opened up the state to sports, youth sports, high school sports, and I know we've had some youth sports, baseball, softball going on, high school sports returning to workouts. How have you seen with the following regulations with that? Are there any reports on how that is going in the state?
The information I have is that the coaches, the athletic directors are being very careful to follow those guidelines. They know what's at risk. If you have COVID incidences as a result of a practice that doesn't follow the guidelines, that jeopardizes the whole program. And so they're taking it seriously. Everything I see, someone sent me a picture yesterday of a team actually doing some kind of a football drill, socially distanced. Obviously it's not contact, but they have to train, they have to work out, and that's where we are right now, is to make sure that those guidelines for gym activities are followed. Obviously, baseball's in a different category, but I think we're all glad to see them coming back. We want them to come back more, but this is a step at a time when it comes to sports, trying to figure it out, get it done the right way, because we want the athletes to be safe, as well as those that come to watch them. With that, thank you all very much for being here today. It's good to be in Pine Bluff. Mayor, we'll see you next time.